Rabies is a One Health issue in Thailand. To better understand why, let's take a closer look at rabies. Rabies is spread through the saliva of an infected animal, and any mammal can transmit the virus. Once a person is bitten, the virus spreads up the nervous system to the brain. The closer the infected wound is to the head, the faster it will travel to the brain. Once it reaches the brain, it is nearly always fatal. There is no test for early stages of rabies. There is a rabies vaccination that can be administered once bitten, and there is also a vaccine for animals. Now let's look at Thailand. Thailand has a large stray animal population, and many domesticated animals are not vaccinated. People usually contract the disease by a bite from a stray animal. Thailand is against killing any animals due to their Buddhist roots. The government is taking steps to eradicate the disease due to the high spike in case fatalities in the 1980s. A top-down approach involving various multisectoral approaches can be effective in addressing rabies in Thailand. The main project activities include mass vaccination, legislative measures, surgical sterilization, and public education about responsible dog ownership. The current approach would combine expertise from the Ministry of Health officials, government veterinarian officers, WHO specialists, representatives from the Global Alliance for Rabies Control, and ordinary citizens. First, the government and other international agencies will undertake various activities like budget allocation, mass vaccination and sterilization of strays, legislation to promote rabies, and surveillance of rabies. The animal and human health sectors, along with NGOs, will initiate interventions aimed at pet mass vaccination, surgical sterilization, and community education. The general population will also play a meaningful role in being responsible dog owners by providing dogs with food, shelter, vaccinations, and sterilization.
Bottom-up approach is critical as the One Health team members speak directly to the members of the community with the intention of gaining a deeper understanding of the issue at hand while attempting to solve it. As part of the bottom-up approach, individuals of the One Health team will interview local hospital officials and patients to get more information on how rabies-infected individuals are treated, its prevalence, and how to educate patients in hopes of preventing the spread of rabies. A critical aspect in the bottom-up approach is also to work with veterinarians to discuss the importance of promoting rabies vaccinations with local pet owners. The One Health team will hang infographics throughout the community to educate people on the importance of vaccinating pets, sanitation practices, and to present the effects of rabies-infected humans.
Potential roadblocks you may encounter are religious history. Thailand has a large Buddhist population who holds dogs highly significant in their religion, and this may cause people to be opposed to vaccinating animals due to the fear of harming them. Lack of accountability for animals by people who feed them, as well as pet owners may refuse to vaccinate their animals if the cost is too high. Farm-bred animals are also cheaper to get, making them more popular than animals from the shelter, even though they aren't vaccinated. Some solutions to these problems are educating the locals and religious leaders about rabies and the importance of vaccination. We can also provide grants for people who are unable to pay pet vaccination. Lastly, lowering the cost of pet adoption will encourage more people to adopt them.
The key to creating good bottom-up outreach and communication is understanding your audience, because those people are the ones who are actually going to be benefiting from the solution. Our audience is Thailand, and because Thailand is 94% Buddhist, our solution is going to have to conform to Thai civil and culture norms, which are mostly Buddhist. Because we're working on an individual or a low-level basis, we need to make sure that we come across as trustworthy, that our message is clear, concise, and efficient. And to ensure that this can take place, we need to work with community leaders or people who already have relationships with those who we're targeting. We also need to make sure that our message is easy to understand, which can happen through something such as a visual medium or through conversation with a trusted individual.
Communication and outreach for the top-down approach consists of communication between the government and health experts in order to create an efficient plan for the public. Begin by asking, how is the government taking action? Let there be a discussion of priorities that will aim to lower the amount of rabies cases. These priorities consist of policies, making sure that people follow them by imposing fines and punishments for those who don't vaccinate their pets. Funding will then allow for better research and use of appropriate equipment. Last but not least, vaccine accessibility should be consistent. Government could provide more vaccines that are not only free, but available in all areas, including low-income communities. Handling these priorities can lead to the distribution of informational pamphlets, creation of vaccine sets, and providing the public help that reflects their concerns. Overall, outreach will help the government and health experts be on the same page and give the public a voice.